To be seen fully in ourselves is to choose to be visible, choosing our freedom over our safety. And I think that's what it is to be non-binary and trans. Sometimes choosing to be in my full body actually means that you might get harm.
Yo, thanks for tuning in again to the Therapy House podcast. It's your boy Jeremiah Knight, and joining me, of course, Jorge Meza, DJ Tables.
Hey, what's up?
In the mix.
Good to be here, man.
Yeah, and of course, we are taking on season 2 headstrong, trying to bring more people in, grow the family, new people, new voices, new perspectives. Joining us today is the Irene Van.
Hello, hello. How y'all doing?
Yes. Decided to bring them in because they're amazing. I know Irene from our days back at the Starlight.
Yes.
So they're still working in there. Oh, see, I'm getting tripped up already.
Already messing up.
So probably not the best way to start.
Already tensing up out here.
Yeah, probably not the best way to start a gender affirming care discussion.
We got to find a way to loosen up, we got to...
No, but I guess we're going to be genuine.
Yes, there you go. I still love you, Jeremiah.
Oh, man. Here we go.
Isn't he awesome?
Yeah, I know. Here we are. So we wanted to discuss issues related to queer and trans clinicians' experiences treating clients, because that's one of the things the majority of us here at Therapy House, we are cisgendered heterosexual clinicians, and we have clients and we work with communities that
who are queer and trans.
Yep.
Because we're in the mental health field, and obviously, we are inclusive therapists, at least from the heart. And so that's something that I want to be able to support clients, and I think all of us do. And Jeremiah, I think, saw that this would be like awesome for you to come on and like talk to us more, because we've all kind of been there where we feel like we've had wins, I feel, with our clients, especially with gender affirming care and learning about it, and even being able to treat anxiety, trauma. But at the same time, I feel like I've experienced lows and almost like personal, like, man, I could have, maybe I just still exploring, and that's kind of where we're at, right?
Yeah. I think there's been definitely times where, even with my clients, I feel like I'm doing a good job, but never 100% knowing, having a little anxiety about messing up pronouns, saying dead names, or even sometimes kind of just blowing their cover about their sexual identity or gender identity.
Yeah.
And a lot of those clients, amazing people, ones that, you try not to have favorites. You try not to blur those barriers of, I really care about them. I hope they're doing well. And there's definitely some times where I question whether I've done enough, or there was something that I was missing, or whether they needed something more from me that either they could not communicate or that I was just not privy to. And I think working in my other job, being able to kind of develop a perspective, assume a particular role, and use your education, your experience, or even just like your personal experience, not the one you just got in college, and learning to develop these ideas or criterias or conceptualizations of what's going on, and then develop a plan, treatment plan, or plan of attack to kind of get them where they need to be. Given my experience as an African-American man, see a client who's kind of patting their head, there's been many stories where it's like, oh, that's psychosis. Oh, there's something wrong with them. No, in the Black community, no. Their hair must have just been done. It itches. Instead of scratching with your nail, you're actually just going to pat it just to kind of ease the tension in the head. And so that's just information I'm privy to that I can include in my perspective, my understanding, at least my treatment plan to rule that out. But many people aren't privy to that information. So then, as being a cisgendered heterosexual clinician, What am I not privy to? That was a conversation Irene and I had one night and talking about it with one of my clients. And as we were working with this client's anxiety and depression, never did it occur to me or cross my mind to even ask about where was their gender dysphoria.
Right.
And how that was impacting their symptoms. And so that's why Irene is here, to better us, make us better clinicians, and hopefully you too. So then, Irene, based on your understanding, your subjective opinion,
We're going to quote you out here.
we're going to work off your definition.
Oh, yeah.
So
snaps.
No pressure at all. From your subjective opinion, what is gender affirming care?
Yeah, that's such a big question. I think gender affirming care, it's like a big question, like cultural humility, right? Like, how do you define it really, right? Like, it's like the basics of being humble enough to know that you don't know everything, right? As a clinician, and also being able to really lean into people's gender experiences, right? Gender and sexuality. I think it's about really providing the space for folks to talk about that openly. And that's whether through your ability to engage with folks through your understanding of terminology, getting their pronouns correctly, being able to like offer them the right resources if they're having gender dysphoria, Like, I think there's so much there. Being able to support them in writing a gender affirming surgery letter if they need it, right? Like, there's so much gatekeeping in the therapist world where folks are like, oh, you have gender dysphoria, you have depression, you have substance use, so I'm not going to write this letter for you to get chest surgery or, bottom or top surgery, right?
Mm-hmm.
But what we have found, or what we know, is that when people get the surgery that they need, a lot of those other symptoms lift, right? Like depression, anxiety. So I think it's creating that space for folks to feel included, but also like developing the knowledge and skills so that you reduce gatekeeping, right? In the community.
As I'm listening to you talk, it's really interesting to hear this whole like gender affirming care parallel with cultural humility, because it is such a basic human rights sort of just thing. But at the same time, you talked about how gatekeeping can happen in gender affirming care. And so where do you feel like you sense in your experience, and I know we're going to talk a little bit about what you do, but I guess where do you sense that shift happens, right? Where someone does want to provide that affirming care, but then there is that gatekeeping, there is that barrier eventually, right? Like these therapists that are saying you have anxiety or you have gender dysphoria, so I'm hesitant to write this letter, right? So where does that shift happen, for therapists that they're so hesitant?
Yeah, sometimes I think the word cultural humility is not enough, right? Because we can be humble, we can like say we don't know enough, but then we also have to like hold responsibility that we have a position of power, that we may hold bias based on like our upbringings, that there's a whole system behind someone coming into your care, right? There's a whole system of oppression that they're coming in with for them to even be able to sit in your room, right? To be able to pay for your therapy services, all of that stuff. And so like, I feel like it's cultural humility plus needing to know more on how to be an advocate and an ally, right? And so like when we are able to recognize our role, how do we reduce gatekeeping? How do we reduce more barriers to getting them what they need, I think it's when we're able to recognize that in ourselves that we have this really like, I don't know, like we have a lot of power in our roles and we have to know how to use it in a way that's effective, Even for a queer, non-binary clinician myself, I have a lot of power over a client that's going to come in, right? So having to know that too. And just knowing that the field has historically been really transphobic and homophobic. This is like old white dudes who created this field, right? Who have looked at trans folks as like defective, right? And created whole diagnoses around it.
Right. And then put like teaching programs all around it.
Yes, teaching programs. And like the founder of ABA, he also was in favor of conversion therapy. So you think about like disabled folks, queer folks, women, trans folks, like these are populations that have been told they're wrong and like put into institutions, right? When we think about like that heavy weight of our history, we have to do something different.
Right.
It's definitely sad. And it's like, I think it's definitely not enough to be just wallowing in it anymore, you know? And I think that's where you tend to see people take that responsibility upon themselves and then feel like, you know, without getting too deep into the rabbit hole, it's almost like that's where people then kind of toe the line on their own. And as therapists, we know that like we are in there in the room with our clients one-on-one. And so we are dancing with this line. If that's happening in the room with an individual, right? And you look at it on a societal perspective, it's going to have tremendous ripple effects, right?
Mm-hmm.
Like when you're impacting schools, communities, you know, intergenerational trauma and the transmission of transphobia, homophobia, everything. I think I'm recognizing that we didn't even start here by asking like what our preferred pronouns are or anything like that.
Yeah.
And almost it's like sometimes in the room, I'm like, I've been trained as a therapist to just like create space for my client. And like you said, like try to just provide this kind of container, right? But sometimes it is like, I think we need to kind of speak out a little bit and be a little bit forthcoming.
Mm-hmm.
That is almost like the modeling also in therapy that we can take perhaps in our role. I don't know. I'm just kind of going on a rant right now, but it's kind of what's coming to mind.
I think it goes into what I was saying to you about gender affirming care being much more than just, oh, I accept you.
Right.
And here's a place. Like, it's like, no, there's a little bit more that goes into it.
Yeah.
For you, Irene, what would you expect? If Jorge and I came to you and we're saying, yeah, we're gender affirming, in your mind, you would then say,
like, what would I expect out of y'all to say to be actually gender affirming?
Yeah, as you're critiquing us just with a clipboard, just, oh.
Well, Jeremiah. Yeah. Well, yeah, I think there's like some signs, right? When you can tell someone's gender affirming. And I've had therapists, my own personal therapist, right? Where they never really talked about gender, even though I'd bring it up, but they would just never really bring it up themselves. And so that silence told me that they might be more uncomfortable than I am. Like I would kind of like throw a hook, right? Like, oh yeah, also I'm non-binary, or, you know, and they're like, okay, cool. But we never talk about it again, right? And then I have therapists who are like, hey, I thought about what you said last week and I'm curious about like how gender plays into that for you. They lean into it, right? And I think it's the leaning in that often, sometimes I think when therapists are not comfortable, they kind of just avoid, right? So gender affirming care to me looks like, yeah, like ask about the pronouns, ask about your gender experience, ask about the sex, you know, like not being afraid to ask how those things influence. And also if a client is just experience something hard at work, be like, oh, do you think it had anything to do with your identity, or how does that affect your identity? You know, like not being afraid to ask. I think that's with like even working with people of color, you know, like a lot of communities, like asking about how culture plays into it. How does like racial identity, gender, all those things, right?
Yeah, and that's like foreign. I mean, I feel like that's not something that we were taught to
No
like,
way.
oh yeah, lean into culture. Like,
Yeah.
So
we live in a very avoidant culture, right? We don't talk about those things, but I think people of color talk about it all the time.
Oh yeah, absolutely.
But I think as therapists, we're taught not to. We're not taught how to do that well, like do it skillfully.
Yeah, or just focus on the nuclear piece, the anxiety that is like, it just shaped a little differently, but it ripples into other areas. And so trying to be honest about that and bring it up.
It's almost like you're not even like doing like a whole integrative care, right? Like you're just like really pretending like it's just going to go away because like you're doing a certain approach, right? Or like you're working on something else or talking about a different thing, like, oh, naturally the stars will correct themselves in kind of mentality. But no, you're right. You know, if it's not being addressed, then it's just going to almost like be normalized for our clients that they are going to be living with this anxiety, right? And in a way almost continue to deal with their internalized, you know, sense of self and how it's impacted.
Yeah.
I've worked with youth, and just being able to honor their name has been so impactful. Sometimes just being the only person. And I think that was like such a powerful feeling. And every once in a while it was like, hey, how are you doing? Just dealing with just me calling your name this way. And just to be able to create space, you know, and again, I think stepping into that fear and unknown that our clients are probably also dealing with on a daily basis, you know?
Yeah. Yeah, I love that because you're like saying it's okay for you to talk about these things here.
Right.
You know, because they might not know that with you if you're identifying and letting them know you're a cis hetero clinician, right? They're like testing, can I tell you this thing? But if you bring it up first, you're like, oh, okay, like this therapist wants to know those things. That's like really cool. And also, like, sometimes we might bring it up and they're like, I'm good. Like, I'm secure about that. Like, you don't have to keep bringing it up.
That's happened too, yeah.
Like, don't keep poking at it. Like, it's just anxiety.
Sometimes I take a deep sigh. I'm like, all right, we're good. Like, okay, it's not affecting you today. All right, we're good. But yeah.
Which is really interesting for you to notice, right? Like, why am I so relieved to not have to talk about this?
And I'm just like, oh man, like, and it's almost like you see the humanity of just how people deal with problems all the time, and it's not always centered around something, but the reality is that just for the majority of our population, for the LGBT, queer, and trans community, it is the ratio is more skewed, you know.
Yeah, I feel like thinking about those moments, I feel like there's a sense of anxiety. Well, if it's like opening the can of worms and I'm not prepared, and I expose myself even more, then again, I mean, that shouldn't stop me from still asking the question. That shouldn't stop me from at least then still like checking if that is affecting you in some way. Because I feel like I've had colleagues or people like, oh, so how does this affect your blackness? And it's like, this doesn't affect anything.
Yeah.
Thank you for asking. There's been some times where it's like, okay, I'm just let them bring it up. But then, there's still a piece of, I don't even know if it's safe enough to bring it up, Jeremiah. Right. So.
Yeah, I mean, if we've had experiences where people make assumptions about us, right, because of our identities, we might not want to do that to someone else, right? We don't want to cause harm to other folks. I do agree, like, maybe it's not, well, so how does that mean around your transgender? You know, like, maybe it's not so direct sometimes unless you have that relationship. But maybe just ask, oh, how do you think that's influenced by all the identities you hold, right? Not just like narrowing in on just that gender piece, right? Or like, I want to acknowledge that we hold a lot of identities and it influences us. Do you think any of that came up for you, you know?
So reading my mind, I was going to ask you, so how do we jump into that conversation? Because actually, I think that would even work with the culture talk. Right.
All of those things, right? Because they're all intersecting, right? Like, I'm not just queer, non-binary, I'm Viet, I'm Asian, you know, all those things.
Right. So you just come in dropping gems. All right. I thought you said you needed some time to warm up.
Let's go.
20 minutes in.
I wonder if like we could talk a little bit about like the pushback in society. Like, and I just sort of where everybody's pulse is, because like, you know, from a personal perspective, there's been, you know, I spoke with you too a little bit about having to feel like I have to stand up and say something and not just stay quiet or even feel like I'm being a bystander, because in my personal life, I feel like that's happened, and it's sometimes even impacted my relationships. Even to my colleagues, like I haven't been in a position where I've had to say something. Fortunately, I have a community of people that are supportive and inclusive, but I know that's not always going to be the case, right? But
a bubble.
Yeah.
I mean, I'm thinking about like all the anti-trans bills that are coming out, right? And like at first we felt like, oh, it's just in Florida, it's just in Texas,
Yeah.
But it's like hitting California now, right? Down in SoCal, they're starting to pass things around. Like if a young person says they go by another identity, you have to disclose that to their parents. Like how messed up it is, right? Now a young person might not come out to you and tell you that they're struggling because they're going to worry that you're going to report to their parents, right? And it's happening in Oakland too, where people are nervous about these new guidelines that are going to come out through some schools, through some Catholic schools. So, you know, we think the Bay Area is like a bubble and like we'll be okay, but it's, you know, all these things are encroaching. And yeah, like even for me, like there's a sense of dissociating from it for a bit, right? Like, oh no, it's not going to happen here. It's not going to happen. Even as a queer trans person, right? And so like now it's like, oh, like how do I step up? And I think that's a question for like our nation, you know, like how are we going to step up?
Yeah, even when like Jorge was saying, there's some people in our families that are just like, oh no, can you believe this? And it's like, yes.
Yeah.
Yeah. Just so at least then a little anxious about the holiday season coming up, because hopefully none of those conversations will pop up. But I think I'm coming to realize, like as clinicians, that we are philosophers to some degree, because we're thinking about life, working with life, and people's believing and perspective upon life. it is fair for other people to also have theories of life and how things work and what's right and what's wrong, even though objectivity is a fabrication. Well, fabrication of
the white man. No, I'm just gonna. Am I allowed to say that?
And hey, if that's the case, then goddamn, you know. But that's the truth for some people, and I feel like, you know, we laugh about it because I feel like we all have some people that we've encountered like that, right? And you know that they're just like, man, like they're like, you see it as like, yeah, you have the right to your opinion and everything, and like you're almost willing to meet people halfway, because not everything in life, you know, is gonna go your way. But sometimes it's like, man, the conviction that's behind it transitions into like outrage or almost like action of this loss of control of your belief, right? Because this is your philosophy of life,
right,
and you don't have control over somebody else's.
And you need, like, the fact that like it's fabricated mainly because you need that to be true. Otherwise, everything else unravels.
Oh, no. Yeah.
And then it's like, oh shit.
What
like,
is my life? What is
everything? Meaning? What's my direction? Like, what? No, I need there needs to be a right. There needs to be a wrong. There's no gray. If there's a gray, then boom. So.
And it's more like, but your right is not right kind of thing, right? Like, it's not even this gray area. It's just the fundamental, like, you're wrong kind of thing. I feel like I've kind of seen, I don't know if there's been other things, but I just kind of see it that way too outside. You know?
That, or like, what does it matter? Like, what does it matter who you love? Like, that's none of my business. I don't have any control of that.
Right.
I'll just focus on my life and how things affect me.
Well, yeah, I mean, I think you said, like, you know, we hang on to our philosophy of life because if we don't, then we have to question everything, right?
Yeah.
But there is a whole system that supports heteronormativity, right? Like, there's a very intentional reason. From colonization, like, people were killing folks who were queer and trans, you know, because they're like, no, we need to keep it man and woman, right?
Yeah.
And, like, we need to control how people love, date, how money is funneled through inheritance, like, all these things, like, queer and trans people would have messed up colonization, right?
Oh, yeah.
So it's like, it's a very intentional thing, and we've all bought into it for so long.
Because we need to, because then we would have to ratify everything else, and a lot of apologies, reparations maybe.
Oh, reparations.
I'm pretty sure there's some.
There's a lot of people who need reparations.
So this season we have a couple of large umbrella topics that we're covering this season, and so this is definitely an episode where we're not going to get to every piece, every challenge that a queer trans clinician experiences today, because we would be here for 20 seasons just for that one episode. And we have episodes on Mexican Latino clinicians, we have therapist anxiety episodes, we have eating disorders, women in therapy.
That's cool.
So yeah, we'd be here all day. So at least I'm just trying to take a limited scope.
Yeah, and I can't speak for all queer and trans clinicians.
No.
Let me just put that out there.
It's like the rainbow is big, guys. Like, it's
big.
y'all, everyone. You see, another one. You know, but
either way, I'm just so happy that you're here. You're sharing with us, and so getting into your experience working with queer and trans clients. What has it been important for you to emphasize in therapy, or the way you go about doing therapy with that population?
Yeah. I think where I go to is like what has been the most joyful moments working with queer and trans folks, right? And I have very specific memories of like just letting them play, right? And experiment in the therapy room. I had a client who was like only 7 years old, identified as a trans male, barely came out to like their family yet, but already was receiving messages around like what he could do and not do in gender. And we would play Play-Doh, make a gender pizza. We would smash the beanbag over like people bullying him, you know, like being able to like try different names on. Yeah, talk about like bodies and just talk about pronouns, like all these things with this 7-year-old who just had so much joy for it, right? And I think for me, like the joy of working with queer and trans youth specifically is getting to be able to help them experiment, right? In a safe space. And so like being able to like try on pronouns, talk about different things, but also like the very real challenges, right? Like they're sneaking around. They want to hang out with their girlfriend, or like the 14-year-old who wants to like hide away from mom, or like, you know, and like really affirming their experiences, and also being like, dang, I imagine that's really hard for you, you know, like because maybe another 14-year-old doesn't have to deal with the same thing you're dealing with.
Right.
It's been such a gift, I think, also being a queer and trans person, to have that sort of resonance with them, right? We can talk about hairstyles, or like, oh, like I see you dressing up with that button up today. How's that feel to you? You know, I think queer and trans folks, we're always having to experiment and be courageous around our hair, our clothes, our posture. And so like being able to like tell them like, oh, I see you in your haircut today, or like, because maybe their family doesn't think it's cool. Their family might say like, why does your hair look like that? You know? So being the one person that's like, I noticed, look at you. Or like, you know, I love that you play around with your gender all the time. Or like, so like uplifting that has been really beautiful, because I wish that happened more often in my life and so many like other folks' lives.
At least in affirming their decisions, their choices, being able to provide them the space to explore and experiment, being able to kind of notice them, see them, and know, like, you know, acknowledge that they're being seen. It sounds like, which is pretty important.
Yeah.
And I think you wanted to also talk about like celebrating it, right? Hey, like that's awesome that you're doing that, right? And in a way, that's like that fine line of I am an ally because I acknowledge that you're here, right? And it's like that bystander effect of, yeah, like, well, somebody else might affirm this person, right? Like, I'm just going to create the space. But you're right, like noticing those things, like really almost like, I guess like, yeah, like meeting that level of expression, right? Our gender expression, and like almost realizing that we all do it. And that's what a lot of these clients that come in are just not experiencing, you know, they are literally just coming in and like it's their own just world, right? They have to self-affirm, right? I don't want to compare it to, I was joking with my friend about sports, right? And how like everybody hates on the Raiders, and I have to self-affirm myself as a fan. I was like, I don't need affirmation from anybody else. I don't need the national media to like talk good about the Raiders. I will talk good about the Raiders myself. Right. But it's like, you know, like, isn't that funny, right? That I'm just like, I have to affirm myself, you know, because nobody else is affirming. It's like, man, one, it's true. You know, that's a jab at the NFL, but
how important it is.
I'm telling you, man, I feel strongly about it. I'm angry, you know, and so, you know,
not to say like the Raiders the same as transphobia.
No, not at all. What you know, it's just that sense of like, man, like it's just so. I laugh about it because like I was joking with my friend how I had to like. I was like outraged about this stupid article, you know, but it's like, it's so trivial, but in the same way as we're having this conversation, like if you're not affirming these people, like, you know that they're coming in and they're not getting this on a daily basis, right? Or the majority of the time, it's not really somebody that's like just celebrating it, right? Taking action and like putting it out into the world, right? Just sort of just being quiet. Right? The discomfort of saying how great your hair, like, you know, you're playing with your gender. I've never heard that. That's lovely. I would love to use that, you know, and working with my clients, because like, who else is going to be able to do that? Sometimes it starts with us as clinicians, because we're the ones that are creating the space, right?
Yeah. And, you know, also like, I want to believe in the resilience of like queer and trans youth who like find their crew, you know, like, hopefully, right?
Yeah.
Like some of them are really good at like finding that cool TV show that has the queer character in it, or like having one other friend, and a lot of them might not have any friends, right? So like, yeah, we might be the first person that they're able to really talk to, or we're going to become one of the people they can along with others, you know? But yeah, as a therapist, like we're trained to really try to see them for their full selves, right? And so we want to be able to celebrate that resilience.
Yeah, but trained is probably a very broad term, because I feel like if we've always been focused on like just a nucleus, and then it'll spread from what we treated. And it's like, I don't know if it works that way. I think like I said earlier, like it's not gender affirming care isn't just, well, accept you. Like it's actual additional efforts.
Yeah.
What you're doing, Irene.
Oh. I was going to say too that like there's two things I'm thinking of. One, there was this quote that came out, and I'm totally going to butcher it, but it was like,
you're going to make it your own. You're going to make it your own.
But it's all about like to be seen fully in ourselves is to choose to be visible, choosing our freedom over our safety, right? And I think that's what it is to be non-binary and trans. Sometimes like choosing to be in my full body actually means that you might get in harm. And I think there's the weight of being able to sit with that for a therapist and reflect that to clients sometimes. Like, wow, like I see how courageous you are that you're doing this. And I also know that this is probably hard too, right? It's a both and situation, I think. And there's varying levels of that for people, whether they can really show up or not, right?
Right.
And I think queer and trans people do it for everybody else. Like, I think not like cis hetero folks. There are times probably like where we grew up or where folks grew up wanting to like express themselves this way and they were told they can't because it didn't fit into the masculine concept, right? Or like boys don't cry, girls don't do this, da da da. It's painful for all of us. When queer and trans people are pushing themselves to do it, it's for everybody too.
Right.
I love that. You know, ever since I learned about just preferred pronouns, I felt like there was part of me that's always resonated with, you know, I have he as a pronoun, but they as well. And to a certain extent, like almost like this hope that like there will one day be a universality of using they because it's, you know, so inclusive. And it isn't that binary part.
Yeah.
But it's so interesting, you know, that even as, you know, cisgender straight males, like I did experience that, you know, and it is like I respect the trans community more because they are always more courageous, you know, and sometimes I would stay quiet when like I wanted to wear, you know, back in like the early 2000s, the fucking skinny ass jeans out here, you know, like pulling them up, like, you know, when everybody was wearing the saggy stuff and I'm just like, you know, no, and I'm going to wear other things and, you know, people just bumming you out, you know, and you don't really realize it. I'm just trying to express my gender, my identity, you know, but I have to fit this norm, you know, and so it's like I let that happen to me and almost just kind of continue to push it down and almost like, oh, I'm just gonna pretend like it's fine, you know, but to take it a step further and really experience just the courage to do it, but also knowing that could be that collateral, you know, like pushback is hard.
I think you should wear those skinny jeans.
Hell yeah, I still do. I still am. The other day I bought some, but you know, I couldn't anymore. That couldn't fit. They couldn't fit. They were cheap at Ross, you know, and I was like, I think I'm gonna rock these. And I was like, oh shit, no, I can't do it.
That's a good place to get skinny jeans. I like that.
Yeah. Dress for less out here.
Yeah, I think I'm just still tired because I feel like this is one of the big topics where, I mean, you kind of think of like, hey, you just being you is not accepted, is like heavy, for me. And then you're saying, hey, even then, going to a place where, oh yeah, this is where I'm supposed to be able to talk about this stuff and really like be myself. There's even limits on that. Just because of how we've been trained or just because we haven't been able to, or at least some clinicians, hopefully not in this room, assume that place of, you know what, I will accept you, but I will just treat this little piece. So I'm not really giving you the full space. I'm giving you some space. I'm not giving you the full what you can. And so just being able to ask clinicians to take that extra step or take that into perspective, because I think it's very easy for us to kind of get into a place of, oh no, we can treat everybody and everything. So unless you have that humility in there.
Yeah. And like, how have we taught to only be seeing people for a problem? Like we're very problem focused, like problem and solution, right?
Yeah.
And we talk a lot about integrative care, holistic care, like, you know, making sure we see the full person, but like we have to diagnose, we have to treat, we have to insurance.
There has to be a problem.
There has to be an issue
necessity.
Here. Yeah.
Which I feel like private practice, I think is definitely changing my perspective on it. I think being able to just treat from like a model and being able to say, hey, we only have a limited time, 6 months, 12 sessions, et cetera, et cetera. But being here and being able to work with no deadline, there's no timeline. We have room to really expand and really just go. If you want to just be here for self-help, then we can make the space bigger and more inclusive. For me, it's been a little bit of a challenge to adjust to that framework now, because I definitely used to think like, wait, you had this kid or this adult here for 2-3 years? Oh, you're doing it wrong. Like, no. There's much more room. And so I think even then, reaching to that level, if you're coming to private practice, then just being able to be like, oh, wait, now there's more accessibility. There's more room to do more things. There's more room to provide quality gender affirming care. Now we just have to kind of rise to the occasion, the opportunity.
I think it's so important to incorporate more gender affirming care and providers in private practice, because now, because we're on this side, you know that there is a wide range of private practice where you can rely on your insurance. And I know this is kind of like a little bit more of like a informational kind of portion of the podcast, but then you have on the other side of the spectrum people that are paying out of their own pocket, out of their salary. Those different hubs, are catered differently in private practice. And it's not always, I would say the providers who are solely working on people that are paying out of their pocket that are maybe having the most inclusive spaces or anything. And I think what I'm realizing as I'm talking out loud is sort of the disparity of just the access to healthcare, and the privilege of being able to work on your well-being without the constraints, and sometimes that might not always be the case for marginalized communities, right? And even like the double minority effect, right? Where you're just like, you're already maybe a minority in this fucking society, and then already you're experiencing twice as much. And so what's the likelihood that this person is going to be able to afford multiple years of therapy with an affirming therapist? And I know that we're not going to find the answer to that today, but it's just, I think that's something that I've noticed also. I don't know if you've noticed it too.
Yeah, food for thought.
Thoughts on that, I guess, right?
Yeah, all the thoughts. Yes, I think, like marginalized communities, you're right. Like it's hella inaccessible. Therapy in general can be inaccessible, right? And if you have multiple identities that are oppressed, so for example, like trans people of color might face larger discrimination at work, might not be able to find work as easily, right? Might have to deal with like unstable housing. So when you think about levels of disparity, so then what means they're going to be able to pay hella money to go into a private practice?
Of course.
You know what I mean?
Mm-hmm.
Yeah, I think that's all really there. And also, I think a lot of people of color, a lot of like queer and trans folks have had to learn how to take care of each other, right? Outside of the medical industrial complex, right? Like had to find ways to heal with each other. That's not always reliant on therapy. And also, like, therapy is amazing. It's just, it's hard to access.
Yeah.
And a lot of insurance companies, like, even like Kaiser, right? Like, it's a challenging space,
What? No.
Kaiser.
No
Kaiser,
way.
y'all know.
No.
I have so many friends who can't find an affirming therapist, and then they just like go with someone and they have to find another one.
Yeah.
Even like folks trying to get surgeries, chest surgery, bottom surgery, having a hard time finding someone who's going to write the letter where they don't have to like get re-traumatized, finding a doctor who's going to do the surgery. All of the layers to get what you need are so hard,
So, I mean, that just brings up so much for me,
It's heavy.
Well, I mean, I was at a symposium last year at Santa Clara, and like we were talking about transitions and the different types of transitions, from surgical to legal to, emotional, especially at different ages, right? And I think that was like a lot of the misinformation that's out there that tends to sort of spill over into those holiday conversations, right? Or even in society, is like when you start to talk about that, because you understand what it means to maybe help someone go through a surgical transition, right? And writing a letter. you understand the context of it, right? And it's not just like a face value that, let's face it, can kind of create like a sense of paranoia in society sometimes, right?
Mhm.
Especially when you're like provided just like these like random, I don't want to say just like videos, but just like things that you see online that is just not always true, and it just continues to contribute to it, you know? So it's like, it's heavy, but it's like when you're so comfortable doing it, I can tell that it's not heavy, right? But it's almost like you see that it can be heavy for somebody else that's hearing it, right?
Yeah. Yeah, when you like live it and you're in it and you see your friends doing it, it's unfortunately normalized, right? And yeah, but it's like, how does it land for other folks, you know? And it's still really heavy in our communities too, right? Like we have to take a lot of collective breaths together too. So can we get everyone's pronouns?
Mine is he, his, him.
I'm he, him, they.
And Irene, they, them.
Can you edit that part to the front?
All right. Let's get back to your experience, Lisa, and let's get personal. You and I, we came from a community-based organization, Starlight. We received referrals from the county. Many times, these cases were assigned to us. We didn't get to choose the clients. The clients didn't choose us. They had no knowledge of us. They just said, hey, Jeremiah's going to be at your house at 3 o'clock on Thursday, and then our journey would begin. For you, we've had conversations about that, and many a times you were thrown into situations where they did not know your pronouns. They did not know your identity. They did not know your sexual identity. And so quite often you were put in a pinch in a way. Can you share a little bit more about your experience and how you kind of handled that space?
Yeah. I will say that like when I first started at Starlight, I was recently more identifying as non-binary and trans at that time, and learning how to come back to my hometown after being in the East Bay and like being around hella queer and trans folks, and like what would it mean to go back to my home and like be able to share this in a professional and personal setting, right? So I'm like dealing with my own like again coming out experience in my hometown, right? And now not coming out just around queerness, but now around gender. And so like it was really hard because I was still figuring out like, and I still am, I'm still trying to figure out my gender expression. How do I want to dress? Do I want to do hormones one day, right? There's a lot of things that are still in the air. And I remember like having dysphoria about like what I would wear every day. I would like do a list in my head, like, okay, I have this client with this parent who's homophobic or transphobic today, so let me dress like this so that I don't appear too trans or queer. Because if I do, they might question it and they might fire me, but I need to work with their queer child. And I really want to continue working with them, you know? So it was like, how do I manage being able to still support this client without outing myself? Because I know their family's homophobic or transphobic. And I had to do that a lot. And then because they also assume I'm straight, they would tell me a lot of, like, I had parents, right, clients who would tell me like, what is this person dressing like, or da 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 da, or like they would say things in front of me, and I'd have to correct them while maintaining that rapport. So it got pretty stressful. Like I would say, how would I dress up every day, depending on the clients I had, or even just like, how much courage do I have today to walk through the world in general? Right? Like, so I think there is this social dysphoria that I was having more than I usually would have in the past, because it was like affecting my role. Like you never want a family to fire you, right? You know? And so I was really working hard not to get fired so that I can still support these youth.
Let alone for just being you, you know? Like,
Yeah, and I think because I was also a bilingual Vietnamese therapist, that means that I was working with a lot of Viet families. And it's like the whole having to sit with like, what does Vietnamese folks think of trans people, right? And like how do you challenge an elder that looks like your mom? You know? And like, especially if my mom at that time, we weren't exactly aligned yet, right? Around like queerness, and she still doesn't know around gender. Well, although I would say she's getting the idea lately as my hair gets shorter and shorter. Yeah. But yeah, I think those are those nuances that I didn't really get to have anyone to share that with. Because like my own supervisor wasn't something I brought up. I was trying to put on a professional face, right? And I didn't know anyone else who was experiencing it. I think in my time, I still haven't met another non-binary or trans clinician at my org, you know? I know there's like queer and trans, like other workers, like admin staff and stuff that I've met, but I don't know. There's queer clinicians for sure, but I don't know how many folks are struggling around like trans non-binary identity. I will also say too that the pandemic was a really interesting time because then I didn't have to deal with that anymore. Like I didn't have to worry about what I wore every day. I kind of just like, you know, like through a Zoom screen, you just like look from the shoulder up. And since being in this like manager role, like I have felt much more comfortable just wearing whatever I wanted because I don't have to worry about a family firing me as much, which is like really interesting.
I mean, to also tack on to your experience, the piece about you just being a Vietnamese clinician, we did not have that many. So it was just, hey, it's Irene or nothing. So,
right. Yeah. There was like 2 of us or something like that. Yeah. Yeah.
So, I mean, it's just further compounds of the pressure you had to experience of just like, I had to stay on this case.
Yes. Yeah. Like who else is going to, work with this client for sure.
Right.
And I've also had really beautiful moments that I didn't expect. Right? Like a parent who said that she didn't care because she did her own research and she found resources and said like, oh, it's normal, right? And I get to say yes. Right? I'm really lucky to be a part of this queer and trans Vietnamese collective that puts out, we do intergenerational conversations with elders, with young folks, and we put out a lot of content. And I like to believe that was like a full circle moment. Like hearing a parent say that they looked up resources in Vietnamese, right? And could find something that could support them in supporting their child. I like to think that like maybe one of those resources was our collective, right? Like those are like the moments I live for, right? Like those juicy moments where like they can finally be like, oh, it's cool.
You hope for that. I think there was a big piece to your story that was identity and just from working from we're not talking about clients, now we're talking about parents, the clinicians' experience with their identity. And quite often queer and trans clinicians, that is a big piece, but they have to be mindful of as they are in the seat. And sometimes that can fluctuate or that can, I guess, cause adversity within their own journey. And so has that been a challenge for you as well as you kind of sit in this clinician role?
You mean like adversity around just like...
adversity, challenges regarding your own identity and trying to find it. And
yeah. I mean, I think there's been experiences, for example, like the dysphoria of having to figure out what to wear every day really sucks, right? Because it can play a toll on my like mental health, right? Like just that anxiety that comes from like having to decide whether I'm going to be found or not. And I don't know if other folks, you know, there's some folks who are hella courageous and they're like, I'm a trans clinician, so you're getting me, you know? Yeah. And I'm still trying to figure out like how to do that. And in some ways, I think like private practice is a route because I get to choose who comes through my doors, right? But then there's that issue of like being inaccessible, right? So there's a lot of things. And I know hella queer and trans friends who are trying to make therapy accessible regardless. But yeah, I think, for example, I remember being at Starlight at a happy hour and I shared that my pronouns are actually they, them. And not a clinician, but one of the staff was like, wait, what? What do you mean? Oh, can we just call you it? You know? And like that's kind of stuff. I was like, whoa. And I was like, we were just about to take a shot, right? And I tried to like joke and be like, hey, okay, whatever. Like, that's not cool, right? But then like 2 days later, I was like, what the fuck? That really fucking hurt, and that took me like a week or so to recover from, because I was like, how do people perceive me? How do people understand my gender? And how serious do people take me,
How do you find yourself kind of like battling with that, like a lot, like deciding whether you need to like confront it then and there, or like do you have to process it like you did, right? And then sort of realize that you were angry, right? And that like this happened, right?
Yeah. Yeah. I think luckily that was probably one of the more like bigger times. Like there's many times where people have misgendered me, and it is every day. Like, do I want to confront it today?
Yeah.
Do I want to correct people today? It's the exhaustion of it, right? It has been a lot better knowing that people are starting to like correct themselves because someone else has told them, and I don't have to be the one anymore. But in the beginning, it was so hard. It was just like, I don't know who else is going to back me up right now, right? And we just don't have a very good way of like correcting pronouns without people getting in their feelings and like making it about them.
Yeah.
I've had to also like take care of people that felt super guilty and had to like private message me and tell me all their like feelings about how bad they're feeling. I'm like, it's not what I want.
Yeah.
But I do think being in a manager role has shifted that for me, right? Maybe because like I don't care as much. Maybe like I'm not working with clients as much anymore. I have a little bit of control over who I interact with. Yeah.
There's a little less opportunity for them to create those microaggressions.
Yeah.
But man, that really does sit with me. The piece of like, how much space do I want my identity to take up today? Or like, how much confidence do I have right now?
Yeah,
like,
how much courage,
man.
how much patience, how much anything, right? Yeah, like I was really lucky to be a part of this LGBT clinical academy. Like they had this like, I don't know how many months, it was at least like 5 months training. But I had just experienced like a really terrible breakup with someone who I told I was trans, or like was thinking of it, and he broke up with me, right?
Mm-hmm.
And like that was like rocked my world, and I could not even sit in the clinical academy because I was like, they were like, yeah, trans people experience these things, and I'm like, I'm experiencing it right now. Like, I just want to cry,
Mm-hmm.
But yeah, it's like, I think as any clinician who also holds an identity of oppression, like we're holding our own personal, and we're also trying to like be a professional, hold it for others.
Yeah.
And that's just rough.
And, like, again, like that double minority standard, right? Because it's so hard. And I think about how I feel so much pride, but also at the same time acknowledging this privilege of being, a cis man who feels so comfortable. Like I always talk with John and like Jeremiah, we're always like talking about how we show up to the room like as we are. And we're always joking about how therapists from back in the day, there was like a stereotype of having to dress a certain way and be a certain manner. And I'm kind of saying, like, I don't want to generalize in private practice, but sometimes, your clients, when they're going to go to a private practice, they don't expect to see their therapist wearing a fucking hat and, like some sneakers. I haven't worn shorts yet. I haven't had the courage to wear shorts to go see my client.
You're not like just wearing your socks, like
that,
Yeah.
But it's like, as a man, like I'm so privileged to be able to decide that. But like and it's like, what a privilege to be able to be like, I wonder what hat I can wear because I want to express myself, and it's like, I feel like I'm still in a position of power where I can temper it with my clients and be like, okay, like, don't worry about it. I'm expressing myself and this is how I am coming into the room, and my clients respect me for it.
Yeah.
And they're like, but on the other hand, for you, that's not the case. Like, you can't do that all the time when you were doing therapy. You having to deal with, am I even going to be respected by the person, by their family members,
Yeah. It's funny, like sometimes I would see the client, but I wouldn't see the parent. And I knew I was like, I'm going to look gay as fuck because I don't want the young person to feel safe. So I would dress like, and whatever the gay as fuck means, right? Like, I don't want to stereotype like what gay is supposed to look like, but for me, it was like, I'm going to dress like button up and my hair's like all, and I'm going to like come in and like look hella fly. I don't want to talk to this young person. Like, there's a lot of debate about like, what does gay even really look like? Like anybody can be gay, right? But for me, it was just like really cool to connect in that way, But then like the next time I'm like, okay, let me go back to dressing this other way,
Sheesh.
I want to be in private practice where I can like dress up however I want because I've marketed myself as a queer and trans therapist for other queer and trans folks, right? And like be able to like show up authentically, however, and like we can like vibe on that, like that would be a dream, to be able to do that.
I mean, if we're talking about identity as well, then the times where you did show up as you wanted to be, free, queer as fuck, what did it mean to you to receive that reaction of acceptance from your clients?
It was beautiful, right? Because like we get to vibe. They're like, oh, cool hair, Irene. I'm like, yeah, same with you, It's like this really beautiful thing where we can like recognize each other, right? Or that moment where they tell me something about them and I'm like, yeah, I went through that before too, without like too much disclosure, right? But like to be able to say like, I understand what you're going through, and they're like, I understand you too, I had this dope client, non-binary Viet client, who went to like, anyways, yeah, so without too much identifying info.
Yeah, we have to.
Right.
You can make it up, though. You can make it up. You can kind of throw it there.
And just a lot of resonance around like similar neighborhood, like growing up, all this stuff, right? And I remember we went to grab some crystals, right? Because I wanted, like, they were really into crystals, so we like did an outing, and they gave me this like crystal that represents the balance of feminine and masculine, and they picked it out for me, and I was like, that is hella fucking cute, because we have that like connection around what it means to be non-binary. And they taught me so many. This is why I love working with young folks, right? Because they have so much wisdom, right? But at one point they were just like, yeah, gender, for me, I always say gender is a performance, right? And they were like, nah, gender is a performance art. I was like, damn.
What you been reading now?
I was like mind blown, right? I was like, oh man, I gotta really think about this. Like they are creating language, they're creating new ways of understanding gender that I didn't get the chance to, and that's fucking beautiful.
Right, especially when you can both be authentic in the same place and provide them the space that you feel in the moment. That's like, I feel so free. I can give you that.
Yeah.
And how amazing that is.
Yeah, or they inspire me to be more free.
Ooh.
Right?
So it's reciprocal.
Yes.
It's countertransference.
Positive countertransference.
If that's even a thing.
Is that a thing? Is that a thing?
I guess so. Yeah. What a beautiful thing it is. So, to capture the variety of different topics we could have addressed, reading from my iPad. Discrimination and prejudice from colleagues and patients. Internalized homophobia and self-acceptance. And this is all from the clinician perspective. This is things that clinicians, trans and queer, have had to deal with.
This is from ChatGPT.
Hey. Don't release my sources. Don't release my sources. Limited or lack of LGBTQ plus inclusive healthcare education, pervasive heteronormativity, balancing personal experience and professionalism, lack of inclusive workplace policies, which we will get to, emotionally charged patient interactions, advocacy and activism, which we'll also get to, navigating professional networks and mentorship, microaggressions and insensitivity, closeted or partial out LGBTQ therapists, a variety of different topics, just to name a few. It's like I said, we could have done 20 episodes on
I feel like we covered a lot of that.
I think we got to do a part 2, part 3 about this real quick.
Probably. But the final one, based off of Irene's experience right now. So Irene, why don't you tell the group, what is your current job right now?
My current job, I am the regional training director at my workplace. So I oversee the training offices in the northern region. And I also facilitate a lot of the diversity, equity, inclusion work.
There we go. That's the one I wanted. That's the one I wanted.
I do that. I guess I do that too.
Well,
That too.
those
I
are
also
low pitch right
taught
there.
SCIS recently.
So,
Hey, I'm just kidding.
from your perspective, as a queer and trans clinician, what do you feel like the biggest challenges have been? And Lisa, what do you feel like we should be advocating for?
There's so many things. I mean, I think DIA work is so expansive, right? And I think that we need to have a stronger, sharper lens, right? When it comes to like understanding queer and trans experience and what does it mean to tackle homophobia, transphobia in our field. So it means everything from like making more inclusive spaces for our clinicians so that they can vibe on these topics, right? To really get together and understand, what are you going through? What am I going through? What are your challenges? We don't have enough of those spaces. We don't have enough of queer and trans folks in leadership, right? You don't see those folks usually. And I think that, there's definitely not enough education or training. We didn't get this in grad school, right? And we're often learning it on the fly. I think queer and trans folks to do a lot of their own research or find it somewhere. And then how hard it is then for even just like the cis hetero clinicians now too.
And have
right?
like quality sources. Let alone,
Quality stuff. And there's good stuff out there, right? But what I often see is that we're not putting in the money and the time, right, to make that important at a lot of agencies. I think luckily Starlight SPHG have been doing some good work around it more recently. There's like headway, right? But, there's always challenges in the DIA world of trying to carve something out that wasn't originally intended to have DIA work in it. But yeah, I think we need to be advocating for more trainings, more education for everybody, and like really pushing people to see themselves more than just allies, but like accomplices in this work. I really am worried with all the anti-trans bills around like, how are they going to come to us for services in schools? How are they really want to come out? And I don't know, I think we have like a strong role to play as therapists to say something. Yeah, I don't know. I guess those are just like the little tidbits I could say there.
Or, entering some, treacherous waters out here, or going into some ambiguous spaces that is a lot of fear. And
yeah.
It's crazy because, like, there's been so much division. And I know there's always, like, this that's like, everybody says that we live in such a divided society, right? But just, like, with the fear that you're experiencing the other side of it and how that is being, I guess, just like the pushback, right? And the fear of the other side, right? That ends up, again, manifesting itself in anti-trans laws is just, I'm also worried for a lot of the people that are trying to also be up in the forefront of all of this, and as therapists, it's almost like, how do we maintain that confidentiality and hold a space, but know that this is actually like a societal thing that's going to kind of have more ripple effects, like, is the change really going to be always on the one-on-one, or like, in how the therapists speak out? I don't know.
I know. I think that's the biggest question of our time of being a therapist, right? I taught a class at CIS on drama therapy and social change. And the big question for us, like, what is the role of a therapist? Are we just another tool for society and social control? Or do we...
Don't get Jeremiah started out here.
Are we, right? Because therapists have been used before to define who is insane, who's not, who's healthy, who's not, right?
What's right, what's wrong, or at least continue that
or
spread
like
of it.
make someone behave well, someone to work better, to fall into these systems. Or are we going to be agents of social change, right? And what is our role in individual therapy, group therapy? I think those are big questions for us to ask ourselves all the time. I'm questioning it all the time. Like, is therapy enough? That's my question all the time.
Yeah, it's a fun place to be, because then you get into the existential, and then we get into those gray areas of then, shit, I don't know.
Yeah. And I don't know if there are answers, but I think it's good questions.
Yeah.
Like we can hold that for ourselves.
Exactly. Try to figure out each
Sit
and every
in the
day.
unknown.
Experiment. I'm just saying experiment, you know?
Yeah,
You're
yeah.
willing to experiment along
Yeah.
the way. Because
What we know is that things aren't working. That's all we know.
Nothing changes and nothing
pretty
changes.
much.
Yes.
All right. So, Irene, for us, we are trying to expand the educational component because, well, here at Therapy House, we talk a whole lot of shit. And sometimes it comes from feeling or theory. So sometimes it's nice to actually have resources to kind of back things up. So is there any resource, media, places of information that you would recommend for anyone that would like to know a little bit more about working with queer and trans clients or being queer trans clinician or anything that you would recommend based on our conversation?
Yeah, I think I'll just share some resources from like the SOGI trainings I lead, right? There's the Family Acceptance Project. I think that's dope. They do some really cool stuff around like how do you get families to accept? How do you talk to families? And the importance of being able to talk to families and not avoid things. They got hella resources and materials. They have like this whole thing on like TFCBT and how to do it for LGBT clients and families.
Ooh.
So if you're like a TFCBT person, you want like catered interventions, they have a whole free report you can look at. Yes, write that down.
I'll check that out.
But also like just like really reading up on queer and trans books, media written by queer and trans folks, right? I love Heartstopper, that new movie, right? Netflix show that's been out for 2 seasons. It's a great show around like queer and trans youth and their coming out process. There's so many good queer and trans comics, poets. But yeah, just like continuing to like really read from them, right? I think that's probably the most important thing I'll say. Yeah, I don't know. There's more, but
Hey, we'll catch in the editorial anyways.
if I remember some, I'll let y'all know.
We'll have it in part 2. Yeah, we're going to bring some more.
There you go. So, it's been another amazing episode of Therapy House. Thanks for tuning in. Irene, if people want to find you or get more of your wisdom, should they contact you? Should they find you on the IG? Or the Twitters or what?
This is such a funny question. I never know how to answer this because I'm so not like social
You're
media
so
prominent
famous.
like that. But folks can always reach me by email.
Message us if you want that email.
Yes. I really need to figure out some sort of.
There you go.
Nah.
They give you a link tree. Come on. If anything, you can find her here at Therapy House.
Them
Here. Gosh.
You can find them here.
I will shout out
If
though, if you want to see any of the work that like me and my community does, it's QT Viet Cafe. Y'all should check that one out. Some dope queer and trans Viet intergenerational dope ass work.
Whoop, whoop, whoop. So if anything, you're trying to find them, you can find them here at Therapy House.
Fine.
Yep.
Whatever.
Yep. So,
It's going to come through Therapy House. I'm sorry.
you have to come.
We do it for the ratings.
Yeah, exactly. You want access to them? Come talk to us first. Boom. Increases our following, our likes, our views, downloads.
Yay.
All right. Peace.
Peace out.
Bye.